Let's start with the basics. Black seed oil is derived from the seeds of Nigella sativa. These seeds contain a bioactive compound known as thymoquinone, and that's where much of the therapeutic magic comes from. Thymoquinone is a powerful antioxidant, anti-inflammatory, and even shows antimicrobial properties. In other words, it doesn't just sit in your system, it actively participates in reducing oxidative stress and calming inflammation, both of which are foundational to chronic disease. Black seed oil, derived from the seeds of Nigella sativa, is a natural compound that has garnered increasing scientific interest due to its wide range of potential health benefits. At the heart of its powerful properties lies a key active compound known as thymoquinone. This bioactive constituent is primarily responsible for the majority of the physiological effects observed with black seed oil. Thymoquinone has been identified as a potent antioxidant and anti-inflammatory agent, which means it plays a crucial role in neutralizing free radicals and modulating inflammatory pathways within the body. Free radicals, which are unstable molecules produced by metabolic processes and external exposures like pollution, smoking, and UV light, can cause oxidative damage to cells, tissues, and even DNA. Over time, unchecked oxidative stress can contribute to the development of chronic diseases such as cancer, heart disease, and neurodegenerative conditions. The antioxidant activity of thymoquinone helps reduce this oxidative burden by stabilizing these harmful molecules, preventing cellular damage, and preserving the body's natural defense mechanisms. Thymoquinone doesn't act in isolation. It also works synergistically with other bioactive compounds in black seed oil, such as nigellone and alpha-heterin, to enhance the oil's overall therapeutic potential. Its anti-inflammatory effects are particularly noteworthy. Inflammation, though a necessary immune response to injury or infection, can become detrimental when it becomes chronic or systemic. Chronic inflammation is a root contributor to many modern health issues, including type 2 diabetes, cardiovascular disease, arthritis, and autoimmune disorders. Research has shown that thymoquinone can downregulate key inflammatory markers such as TNF-alpha, interleukin-6, IL-6, and prostaglandin E2. These markers are typically elevated in various inflammatory conditions and are often used as indicators of inflammation severity. By suppressing their activity, thymoquinone helps the body maintain a more balanced inflammatory response, which is essential for long-term health and disease prevention. In animal models and in vitro studies, thymoquinone has also been shown to inhibit the activation of nuclear factor kappa B NFJ, a protein complex that plays a central role in regulating immune response and inflammation. This inhibition is significant because NFJB is a major signaling pathway involved in the expression of pro-inflammatory genes. By interfering with this pathway, thymoquinone contributes to a dampened inflammatory response at the molecular level. In clinical settings, this has translated to observable improvements in inflammatory markers in patients with conditions such as rheumatoid arthritis, asthma, and even certain types of allergies. Furthermore, thymoquinone has been studied for its potential in reducing inflammation in the respiratory tract, suggesting a benefit in managing chronic respiratory diseases such as COPD and asthma. In this context, black seed oil is often explored not just as a supplement, but as an adjunct therapy alongside conventional treatment options. Beyond inflammation and oxidation, thymoquinone also appears to offer protection to vital organs, particularly the liver and kidneys, both of which are essential in detoxification and metabolic processes. In studies examining liver toxicity induced by various drugs or chemicals, thymoquinone has shown hepatoprotective effects by enhancing the liver's antioxidant defense system and reducing lipid peroxidation, a damaging process involving the oxidation of fats within cell membranes. Similarly, kidney studies have indicated that thymoquinone can mitigate nephrotoxicity by reducing oxidative stress and inflammation in renal tissues. These organ protective properties make black seed oil an area of focus for researchers looking into integrative approaches to chronic conditions involving multi-organ stress. Another area where thymoquinone demonstrates considerable promise is in the realm of cancer research. Although human trials are limited and still in early stages, preclinical studies have consistently shown that thymoquinone possesses anti-proliferative and pro-apoptotic properties. In other words, it can inhibit the growth of cancer cells and induce programmed cell death in tumor cells, especially in cancers of the breast, colon, pancreas, and prostate. Mechanistically, thymoquinone interferes with cell signaling pathways that are crucial for cancer cell survival, such as the PI3-CoAC and MAPE pathways. It also promotes the expression of tumor suppressor genes like p53 and downregulates anti-apoptotic proteins such as ECL2. While this does not yet position black seed oil as a standalone cancer therapy, it raises the possibility that thymoquinone could play a supportive role in comprehensive cancer care, pending further clinical validation. Cardiovascular health is another domain impacted by the antioxidant and anti-inflammatory qualities of thymoquinone. Studies suggest that black seed oil may help reduce blood pressure and improve lipid profiles by lowering LDL cholesterol and triglycerides while raising HDL cholesterol. These effects are believed to be mediated in part by the compound's ability to relax vascular smooth muscle and reduce systemic. The immunomodulatory effects of thymoquinone are also of interest, especially in an age where immune system balance is crucial. It has been shown to enhance natural killer cell activity and support T-cell function, which are critical components of the adaptive immune response. At the same time, it appears to suppress overactive immune responses that contribute to autoimmune flare-ups, indicating a unique capacity to both strengthen and regulate immune activity. Determining the right dosage of black seed oil is crucial for both safety and effectiveness, and this often depends on the form in which it's taken, the individual's health goals, and their overall sensitivity to natural compounds. Clinical studies and traditional practices typically recommend a daily intake that ranges from 500 milligrams to 2 grams when taken in capsule form. This dosage is considered both safe and effective in a wide range of therapeutic applications, including metabolic support, immune modulation, and anti-inflammatory purposes. When using the liquid oil form, this is generally equivalent to approximately half a teaspoon to 1 teaspoon per day. It's important to recognize that black seed oil is not a substance where large doses yield quicker or better results. In fact, its efficacy comes more from sustained, consistent intake over time rather than from aggressive short-term dosing. The body responds to thymoquinone, the active component in black seed oil, through subtle physiological changes that accumulate and balance out various internal processes like oxidative stress reduction, inflammation control, and immune modulation. When people begin supplementing with black seed oil, it's often recommended to start with the lowest effective dose, especially for individuals who are new to it or have underlying health concerns. Starting low, perhaps a quarter teaspoon or 1 capsule a day, allows the body to gradually adapt. Some individuals may be more sensitive and could experience a mild gastrointestinal discomfort when starting supplementation. This is particularly true for those with sensitive stomachs or pre-existing digestive issues. To mitigate this, taking black seed oil with food is advisable. Food buffers the stomach lining and improves the emulsification and absorption of the oil, which is lipid-soluble. Fat-soluble compounds like thymoquinone are better absorbed in the presence of dietary fat, so consuming black seed oil with a healthy fat source such as olive oil, avocado, or a full meal can enhance its bioavailability. One reason to keep the dosage within the recommended range is that thymoquinone, while beneficial in moderate amounts, can exhibit a biphasic effect. In small to moderate doses, it may provide strong antioxidant and anti-inflammatory benefits, but in higher concentrations, it can potentially cause oxidative damage rather than prevent it. This principle, often referred to as hormesis, is common with many plant-based compounds. It reminds us that natural doesn't always mean inherently safe in excessive amounts. Therefore, people who consume black seed oil in large doses under the assumption that more is better may actually be exposing themselves to unintended consequences. In animal studies, extremely high doses have been linked to liver enzyme elevation and kidney stress, although these levels far exceed what is used in human supplementation. Nevertheless, sticking to a modest, effective range ensures a higher margin of safety and a more balanced effect on the body's internal systems. Different goals may call for slightly adjusted dosages. For example, individuals using black seed oil for blood sugar control in type diabetes may benefit from doses closer to the higher end of the standard range, closer to 2 grams daily, as used in certain clinical trials. In contrast, someone using it for general wellness, immune support, or skin health might maintain results with a lower dose, closer to 500 mg per day. These goals should always be aligned with lifestyle factors, nutrition, and any medications currently in use. For people on medications like antihypertensives or antidiabetics, it's wise to begin at the lower end of the dosage range and monitor for possible additive effects, such as drops in blood pressure or blood glucose levels. Black seed oil has been observed to mildly enhance insulin sensitivity and lower fasting glucose, so for individuals who are already managing those metrics through pharmaceutical intervention, There's a possibility of overcorrection if careful attention isn't paid. Some individuals may choose to cycle their use of black seed oil. This approach involves using the oil for several weeks or months and then taking a short break before resuming. While this strategy hasn't been conclusively studied in controlled trials, it is often adopted as a precautionary method to prevent the body from developing tolerance or to observe how the body functions without the supplement for comparison. Others may find that long-term, daily use at low doses works well without the need for cycling, especially in the context of chronic inflammation or long-standing metabolic imbalances. Ultimately, the correct approach may vary based on the body's response, the consistency of use, and individual feedback over time. Liquid black seed oil has its own considerations regarding dosage. Because it has a strong bitter and often peppery taste, some people may find it difficult to consume directly. Mixing it with honey or warm water can make it more palatable. For topical use, the amount applied varies greatly, but typically ranges from a few drops to a teaspoon, depending on the size of the area being treated. For instance, individuals using it for joint pain or eczema might apply it directly to the skin, often diluted with a carrier oil to prevent skin irritation. In such cases, the concentration and frequency matter more than the total volume used. While topical applications usually don't result in systemic absorption levels as high as oral intake, they can still offer localized benefits and should be factored into the overall usage plan. One advantage of black seed oil capsules is dose precision. Each capsule contains a standardized amount, often 500 mg, making it easier to track and adjust intake. This format is especially useful for individuals who are aiming for therapeutic consistency and don't want to deal with the oil's taste or the variability that can come with spoon dosing. However, it's important to choose high-quality, cold-pressed oils that are free from additives and contaminants, whether in liquid or capsule form. Black seed oil should be stored in a cool, dark place to preserve its potency, as exposure to heat and light can degrade thymoquinone content over time. If refrigerated, it can remain fresh for longer. Although this may make the oil more viscous and harder to pour or measure accurately, consistency in dosing is perhaps the most critical factor when it comes to achieving desired health outcomes with black seed oil. Rather than focusing on acute high doses during times of illness or stress, the most beneficial approach appears to be integrating the oil into a daily health routine. This allows the body to adapt gradually, supporting key physiological systems such as the immune, endocrine, and nervous systems. Even though black seed oil works subtly, its influence accumulates across time and systems, making a modest but regular intake a powerful tool in long-term health management. The body responds to patterns, not isolated incidents, and natural compounds like thymoquinone tend to work best when they are part of a broader lifestyle approach involving diet, sleep, movement, and stress management. Taking black seed oil with food or honey can significantly enhance its absorption and minimize the risk of gastrointestinal discomfort, making it a more effective and tolerable supplement. The reason for this lies in the chemical nature of its key active compound, thymoquinone, which is fat-soluble. Fat-soluble compounds are best absorbed when consumed with dietary fats, which stimulate bile production and emulsification in the digestive tract. When black seed oil is taken on an empty stomach or without accompanying food, some individuals may experience nausea, cramping, or a burning sensation in the stomach. This is especially true for those who have sensitive digestive systems or underlying conditions such as gastritis or acid reflux. By consuming the oil with food, the digestive process is supported in a way that improves both comfort and bioavailability. The combination of black seed oil and honey has deep roots in traditional medicine systems, particularly in the Middle East and parts of Asia, where both ingredients are revered for their health-promoting properties. Honey itself possesses antimicrobial, anti-inflammatory, and antioxidant characteristics and is rich in simple sugars, enzymes, and phenolic compounds that complement the actions of thymoquinone. When taken together, these two natural substances may have synergistic effects. In fact, small-scale clinical and animal studies suggest that combining black seed oil with honey can enhance their antibacterial activity, particularly against harmful gut pathogens like Helicobacter pylori, which has been implicated in gastritis, peptic ulcers, and even stomach cancer. The sweet profile of honey also masks the strong and often bitter taste of black seed oil, making it easier to consume consistently, especially for those who find the pure oil unpleasant. Incorporating black seed oil into meals provides additional benefits. It can be drizzled over salads, mixed into smoothies, or added to dips like hummus or yogurt. This approach not only improves its flavor profile, but also integrates it seamlessly into daily eating patterns. Using it this way ensures that it is consumed alongside natural fats and proteins, which further support its digestion and assimilation. When black seed oil is incorporated into meals that include monounsaturated or polyunsaturated fats, such as those found in nuts, seeds, avocados, or olive oil, the absorption of thymoquinone and related compounds is optimized through micelle formation in the intestines. This is the same physiological principle that supports the improved absorption of fat-soluble vitamins like A, D, E, and K. Timing also matters when considering how to take black seed oil. While some people take it in the morning to align with other supplements or health routines, others prefer taking it in the evening due to its mild calming effects, which can help promote rest and recovery. The presence of food in the stomach during either of these times can act as a buffer, preventing potential irritation and slowing the release of the oil into the digestive tract. This gradual absorption may not only make the oil gentler on the gut, but could also result in more sustained plasma concentrations of thymoquinone, especially when taken regularly. This steady delivery system aligns with how most natural compounds work best, not in sudden spikes, but through consistent and moderate presence in the body's internal environment. Digestive comfort is an important consideration, particularly for people who are taking multiple supplements or medications. Adding black seed oil to a meal or pairing it with honey ensures that it doesn't compete too aggressively with other compounds for absorption and processing by the liver and gut. Honey, with its natural enzymes and prebiotic properties, may also support the activity of beneficial gut bacteria, which can in turn support the breakdown and metabolism of plant oils. Some users have reported improved digestion, less bloating, and better tolerance when consuming black seed oil in this way. This is likely due to a reduction in irritation and more favorable interactions with the gastrointestinal mucosa, allowing for better acceptance by the body over time. Cultural and traditional uses also point to the wisdom of consuming black seed oil with food or honey. In many regions where it is a staple remedy, it is never taken in isolation, but always combined with something else to moderate its intensity. This practice reflects a long history of empirical knowledge, now increasingly supported by modern pharmacokinetic and clinical data. By respecting these traditional methods and aligning them with scientific understanding, users can achieve a more effective and harmonious experience when using black seed oil for therapeutic purposes. Choosing the right type of food or honey to pair with black seed oil can also make a difference. Raw, unfiltered honey is preferable as it contains more of the beneficial enzymes, pollen, and antioxidants that may enhance the oil's effects. Similarly, whole, minimally processed foods that are rich in healthy fats and phytonutrients offer a more supportive digestive environment than heavily processed or refined meals. When these elements are combined thoughtfully, they can create a powerful synergy that allows black seed oil to work more efficiently within the body's complex systems. This careful combination of timing, food pairing, and delivery method helps create a more reliable and enjoyable supplement routine that aligns with both modern science and ancient practice. Black seed oil has been widely studied for its diverse range of health benefits, particularly in areas related to immune function, blood sugar regulation, skin health, and cognitive performance. These effects are primarily attributed to thymoquinone, the key active compound in the oil, which exhibits powerful antioxidant, anti-inflammatory, antimicrobial, and immunomodulatory properties. When used consistently at appropriate doses, black seed oil can influence various physiological systems, supporting health in a holistic and integrative way. One of the most prominent areas where black seed oil shows promise is in immune system modulation. Rather than simply stimulating or suppressing the immune system, it appears to help balance it. Thymoquinone has been shown to enhance the activity of certain immune cells, like natural killer NK cells and macrophages, which are essential for identifying and destroying pathogens. At the same time, it can suppress overactive immune responses that might otherwise lead to chronic inflammation or autoimmunity. This dual action makes it particularly valuable for people who need immune support without triggering excessive immune activation. In the context of infections, black seed oil has demonstrated antimicrobial activity against a range of bacteria, viruses, fungi, and even some parasites. It's been studied for its effectiveness against Staphylococcus aureus, E. coli, Candida albicans, and Helicobacter pylori, among others. Its antibacterial and antifungal properties are not only valuable for internal immune defense, but also for skin conditions, where it may help treat acne, fungal infections, or minor wounds. By reducing microbial load and inflammation simultaneously, it promotes faster healing and a healthier skin barrier. Additionally, the oil contains small amounts of beneficial fatty acids, including linoleic and oleic acids, which help maintain the integrity of skin cells and provide moisturizing benefits. These features make black seed oil an appealing option for both internal immune support and external skin health management. When it comes to blood sugar regulation, black seed oil has shown a consistent ability to lower fasting glucose levels and improve insulin sensitivity in individuals with type 2 diabetes and metabolic syndrome. The mechanisms behind this effect involve modulation of glucose metabolism pathways and the reduction of systemic inflammation that impairs insulin function. Several clinical studies have shown that daily supplementation with black seed oil or black seed powder can lead to significant improvements in HbA1c, a key marker of long-term glucose control. This suggests that Thymoquinone may improve pancreatic function or reduce insulin resistance at the cellular level. For individuals dealing with prediabetes, insulin resistance, or metabolic disorders, black seed oil may offer a natural adjunct to conventional treatments, supporting better glucose control without the side effects often associated with pharmaceuticals. It is not intended to replace medications, but it may enhance the effectiveness of existing interventions when used as part of a comprehensive approach to metabolic health, to cognitive performance, and brain health are also areas where black seed oil shows potential. The brain is particularly vulnerable to oxidative stress due to its high oxygen consumption and lipid-rich structure. Thymoquinone's ability to cross the blood-brain barrier and reduce oxidative and inflammatory stress within neural tissues has led researchers to explore its neuroprotective effects. In animal models, supplementation with black seed oil has improved memory, learning, and spatial awareness, especially in conditions that mimic neurodegenerative diseases like Alzheimer's and Parkinson's. These effects may be attributed to its role in modulating neurotransmitter levels, particularly acetylcholine, and in reducing the accumulation of beta-amyloid plaques, which are linked to cognitive decline. While human trials are limited, early data are promising and suggest that regular use of black seed oil may help support brain function, improve mental clarity, and potentially slow the progression of age-related cognitive disorders for people dealing with chronic fatigue, brain fog, or low energy levels. The anti-inflammatory and antioxidant actions of black seed oil may help restore mitochondrial function and reduce the oxidative burden that interferes with energy production. This is particularly relevant in today's fast-paced lifestyle, where chronic stress, poor diet, and environmental toxins contribute to reduced mental and physical resilience. By supporting systemic detoxification and reducing inflammatory load, black seed oil can assist in restoring vitality and focus on skin health, both from the inside out and topically. Is another area where black seed oil proves useful. When taken orally, it helps regulate immune responses that contribute to inflammatory skin conditions such as eczema, psoriasis, and acne. Internally, it works by modulating cytokines and reducing inflammatory markers, which are often elevated in these skin disorders. When applied externally, black seed oil provides a soothing and antimicrobial effect, helping to calm redness, swelling, and microbial activity that exacerbate skin issues. It also promotes the regeneration of healthy skin tissue and supports the natural healing process. For individuals with dry or irritated skin, the fatty acid content of the oil helps restore the skin's lipid barrier, improving moisture retention and elasticity. Because of this, black seed oil is often found in natural skincare formulations and is used as a home remedy for everything from scars to burns to fungal infections. Its effects are not limited to specific conditions, but extend to overall wellness. Individuals who incorporate black seed oil into their routine often report better energy, improved digestion, more restful sleep, and fewer symptoms related to chronic inflammation or immune dysfunction. These broad benefits may be the result of the oil's impact on interconnected systems within the body, particularly the gut, immune system, endocrine system, and nervous system. By influencing each of these systems simultaneously, black seed oil offers a type of health support that is both gentle and far-reaching, creating a more resilient internal environment capable of withstanding stress, toxins, and age-related decline. Topical use of black seed oil has gained popularity for its ability to address a wide range of inflammatory skin conditions, including acne, eczema, psoriasis, and fungal infections. The oil contains thymoquinone, which is known for its anti-inflammatory, antimicrobial, and antioxidant properties, making it an effective natural agent for skin support. When applied directly to the skin, black seed oil interacts with the epidermis and dermis layers, helping to calm irritation, reduce redness, and combat pathogens that may be present on the skin's surface. Its ability to penetrate the skin barrier allows it to work on both superficial and slightly deeper layers of the skin, delivering targeted relief to inflamed or infected areas without the harsh side effects of synthetic treatments. One of the most common uses for topical black seed oil is in the treatment of acne. Acne is typically caused by a combination of factors such as excess sebum production, bacterial overgrowth, and inflammation within the pores. Black seed oil's antimicrobial action, especially against Propionibacterium acnes, the bacterium commonly associated with acne, can help reduce bacterial colonization and lower the risk of breakouts. Simultaneously, its anti-inflammatory effect soothes irritated skin and reduces the swelling and redness that are characteristic of active acne lesions. In addition, the oil contains a small amount of vitamin A amino acids and fatty acids which support skin repair and help prevent scarring once acne lesions begin to heal. Eczema, another condition marked by dryness, itching, and inflammation, also responds well to black seed oil. Its emollient nature helps restore moisture to the skin and strengthens the skin barrier, preventing further irritation from environmental allergens or irritants. Studies have shown that thymoquinone can inhibit the production of inflammatory cytokines like interleukin-4 and interleukin-13, both of which are elevated in individuals with eczema. This leads to a reduction in itching and flaking over time. Regular application of black seed oil in eczema-prone areas may help prolong remission periods and reduce flare-up intensity, especially when used as part of a broader skincare regimen that includes hypoallergenic moisturizers and avoidance of known irritants in the case of psoriasis, which is an autoimmune condition characterized by rapid skin cell turnover and chronic inflammation. Black seed oil helps slow the proliferation of skin cells and reduce inflammatory signaling. While it is not a cure for psoriasis, topical application may reduce plaque thickness, redness, and scaling in affected areas. The antioxidant properties of thymoquinone further help protect skin cells from oxidative stress, which plays a role in exacerbating inflammatory skin diseases. A black seed oil may be particularly beneficial when used in combination with other treatments like phototherapy or topical corticosteroids, potentially reducing the required dosage and associate its effects of pharmaceutical options for fungal infections such as athlete's foot, ringworm, or candida overgrowth on the skin. Black seed oil offers antifungal activity that can help control and eliminate fungal pathogens. Laboratory studies have demonstrated its effectiveness against various strains of Candida albicans and Aspergillus niger, two common fungal organisms. Its application to affected areas several times a day may reduce fungal growth, alleviate itching, and restore the skin's natural barrier. When dealing with fungal infections, it is often beneficial to combine black seed oil with a carrier oil like coconut oil, which has its own antifungal properties and helps the product spread more easily over larger areas. Black seed oil is also commonly used for joint pain, muscle soreness, and localized inflammation, particularly in individuals with arthritis or overuse injuries. When massaged into the skin, it may help reduce stiffness and improve mobility in affected joints. The mechanism involves its ability to inhibit pro-inflammatory enzymes like cyclooxygenase and COX, which are responsible for pain and inflammation. Additionally, the warmth generated by massage combined with the bioactivity of the oil enhances blood circulation and encourages lymphatic drainage in the area. For general skincare and cosmetic use, black seed oil can be incorporated into daily routines as a natural moisturizer or as an ingredient in DI face masks and serums. It contains essential fatty acids like linoleic and oleic acid, which are critical for maintaining the lipid barrier of the skin and preventing transepidermal water loss. This keeps the skin hydrated, plump, and resilient against environmental stressors such as pollution and sun exposure. Because of its non-comedogenic nature, it is suitable for most skin types, including oily or acne-prone skin, without increasing the risk of clogged pores or breakouts. It's important to note that black seed oil should be patch tested before widespread use on the skin, especially for people with sensitive skin or a history of allergic reactions. Applying a small amount to the inside of the wrist or behind the ear and waiting 24 hours can help determine if any irritation occurs. In some cases, direct application of undiluted oil may cause mild burning or redness, so dilution with a carrier oil like jojoba, almond, or coconut oil is often recommended. The dilution also helps improve the spreadability and absorption of the oil across larger surface areas, as scars and stretch marks are other cosmetic concerns that may benefit from regular application of black seed oil. Its regenerative effects help improve skin texture and tone, while its anti-inflammatory actions reduce the redness and hyperpigmentation associated with healed wounds or trauma. Over time, the oil supports collagen production and may gradually reduce the appearance of old scars or uneven skin patches, making it a useful addition to post-surgical or post-Atkins scar care routines. Its application can be enhanced when paired with gentle massage or derma rolling, which increases absorption and stimulates skin regeneration further. A long-term, consistent use of black seed oil is more effective than high, short-term doses because of the way natural compounds interact with the body's systems over time. Unlike synthetic pharmaceuticals that are designed for immediate impact, the active ingredients in black seed oil, especially thymoquinone, work gradually by supporting biological processes rather than overriding them. When taken regularly in small, appropriate doses, black seed oil gently influences inflammation, immunity, metabolic function, and cellular health in a cumulative way. This is consistent with how the body naturally responds to dietary interventions and herbal therapies, which often require time to produce measurable effects due to their more subtle and harmonizing mechanisms of action. Short bursts of high doses, while they might seem appealing for quick results, can sometimes overwhelm the body's detoxification pathways or produce unwanted side effects such as digestive upset, liver enzyme elevation, or changes in blood pressure. High doses may also trigger hormetic responses, where the benefits seen at lower doses reverse at higher concentrations, leading to diminished effectiveness or even mild toxicity. This is particularly relevant with thymoquinone, which has shown biphasic behavior in scientific studies. At low to moderate doses, it exerts antioxidant and anti-inflammatory effects, while at high doses, it can act as a pro-oxidant, potentially causing oxidative stress rather than preventing it. Therefore, using black seed oil as a daily supplement at a steady, moderate level allows the body to safely incorporate its therapeutic benefits without triggering adverse reactions or imbalances. Consistency allows thymoquinone to become a regular presence in the bloodstream and tissues, where it can help modulate chronic low-grade inflammation, a common denominator in many modern health problems such as diabetes, cardiovascular disease, autoimmune disorders, and neurodegenerative conditions. By maintaining a consistent intake, the compound can continuously influence gene expression, enzyme activity, and immune signaling in a beneficial way. This repeated low-level exposure aligns more closely with the body's natural rhythm of healing and regeneration. It supports cellular repair, mitochondrial function, and hormonal balance without overstimulation or shock to the system. Additionally, consistent use helps build a foundation for long-term resilience. For example, people using black seed oil for blood sugar management may not notice immediate changes in fasting glucose or insulin levels within the first few days. However, over several weeks or months, improvements begin to surface as the oil works alongside other metabolic processes to enhance insulin sensitivity, reduce oxidative stress in the pancreas, and promote better glucose utilization by cells. These benefits are often slow to emerge but become more stable and lasting with time. Similarly, when used for immune support, black seed oil can gradually modulate immune cell activity, improving the body's ability to fend off infections and manage autoimmune reactivity without suppressing necessary defenses. Skin conditions, which are often a reflection of internal inflammation and immune imbalance, also tend to respond more favorably to steady, ongoing supplementation rather than sporadic high dosing. Eczema, psoriasis, and other chronic dermatological issues often improve not just from the topical application of black seed oil, but from sustained internal use that calms the underlying inflammatory response. The skin, being a secondary detoxification organ, benefits when systemic inflammation is reduced over time, leading to clearer, healthier, and more resilient skin. This kind of healing requires a patient, long-term commitment, rather than an attempt to force quick results. For cognitive health and neuroprotection, consistent intake allows thymoquinone to cross the blood-brain barrier regularly, supporting antioxidant defense in brain tissue and reducing neuroinflammation that contributes to conditions like brain fog, age-related memory decline, and neurodegenerative disease progression. The brain thrives on stability and routine, so introducing black seed oil in a consistent, measured way fits into that framework of gentle, sustained support. The neuroprotective effects build slowly and over time, may enhance cognitive clarity, focus, and memory by nourishing the nervous system from the inside out. Digestive health is another area that benefits from steady use. Black seed oil can support a balanced microbiome, reduce gut inflammation, and promote smoother digestion when taken consistently. Sporadic high doses may irritate the stomach or disrupt the balance of gut flora, but a modest daily amount can support digestive tract integrity, stimulate bile flow, and enhance nutrient absorption. These improvements may not be immediately visible, but accumulate slowly, contributing to improved overall wellness, better energy levels, and more efficient elimination over time. The psychological aspect of consistency also plays an important role. When a supplement like black seed oil becomes a regular part of one's routine, it reinforces a mindset of intentional health maintenance. This behavioral consistency often leads to other healthy habits, such as better dietary choices, improved sleep patterns, and greater awareness of how the body responds to different inputs. Black seed oil becomes a small but meaningful part of a broader system of self-care, one that respects the natural pace of healing and regeneration from a practical standpoint. A daily use of black seed oil is easier to sustain than high-dose strategies that require intense monitoring or frequent breaks due to side effects. A teaspoon a day or a capsule twice daily becomes an easy and sustainable habit that does not interfere with daily life. It integrates seamlessly into morning or evening routines, making it more likely that the individual will stay committed and reap the long-term benefits that only come with time and repetition. The body thrives on rhythm and routine, and when black seed oil is introduced into that rhythm consistently, its effects become more reliable, deeper, and longer lasting across various systems in the body.